Hi guys, Transform Your Teens, a webinar series brought to you by Invisalign. Invisalign system is the world's most advanced technology for teeth straightening, and Invisalign believes in transforming and changing smiles. Hi again, I think I should start by introducing myself. My name is Chhavi Mittal, and I think my biggest introduction is that I'm a mom of two. And when I'm not taking care of my kids, I'm usually creating digital content. I have multiple platforms where I create different kinds of digital content. Some of it is entertainment, some of it is infotainment. But I think today's session holds like a lot of value to me because I'm a mother. And with Invisalign's Transform Your Teens initiative, today we'll be exploring the theme of peer pressure and self-image issues faced by teens. And I know that if this was not an online session and an offline one, I would see a lot of heads nodding in the audience. I can only imagine the audience also getting all excited about having this conversation today. So I feel that teenage years are of prime importance, right? We all believe that, correct? And I think most of the things that a person does as a teen define what he's going to grow up to be and how his life is going to shape up. So obviously it's very important for a parent to understand what their teens are going through in life. And sometimes it gets a little difficult to understand that. But I think if we start these kind of conversations, we can not only empathize with our kids, but also be able to initiate that dialogue, which is so important with our teens at all times. And I think to further explore this topic, I would like to invite the first panelist of the day. And I want to say that this person hugely inspires me. This is Priya Kumar, who is an internationally acclaimed motivational speaker and a keynote speaker. She's a best-selling author of 13 inspirational books and is also a screenplay writer. Has worked with almost 2,000 multinational corporates across 47 countries. She has over 700 published columns for national and international publications. She is India's first certified fire walker instructor and has conducted over 2,000 fire walks across the globe. I'm going to go on, Priya, for just a minute. Known as the biography specialist, Priya has penned the biographies of leading industrialists and legendary businessmen like O.P. Munjal and is now writing the story of Pullela Gopichand, the chief national coach for the Indian badminton team. Turned filmmaker and screenwriter, Priya has made a Bollywood debut with the book I Will Go With You as a debut web series, The Final Call, which is streaming on ZEE5. Priya, I just want to ask you, do you want to leave anything for the rest of us to do or still wear all the hats yourself?
Well, I have a lot of time and thank you for the lovely introduction. First of all, I must say you speak very well. And since this is Invisalign, I love your smile.
Oh, thank you. Thank you so much.
And when an introduction like this comes up, it's already a lot of pressure, that I don't know what gold nuggets you're expecting from me.
Yeah, yes. Totally. We are expecting a lot from you. But first of all, thank you so much for joining us today.
Most welcome.
And let me now invite the second guest of the day, which is Dr. Tapasya Kapoor, a consultant orthodontist practicing over 20 years and a distinguished topper from the prestigious Manipal University. An ex-professor, Dr. Tapasya has also been involved in teaching for over years for undergraduates and postgraduates in dental colleges in Delhi and NCR. Hi, Doc. She has been chosen as a key opinion leader and speaker for Invisalign in India and is a platinum elite Invisalign provider. She also conducts training programs in the country and guides orthodontists in Invisalign treatments and advancements. Dr. Tapasya clientele includes patients from the American Embassy School, the British School, French International School, just to name a few. She is empaneled with various embassies such as the American, British, French, Mexican, Japanese, Kuwait, German, Norway, Spain, and a lot more. She works closely with general, pediatric, and cosmetic dentists, as well as other dental specialists in order to provide personalized orthodontic care for both children and adults. She has an impeccable eye for aesthetics and is passionate about natural smile transformations. She takes special care to provide a personalized and compassionate treatment that can deliver exceptional results. A very, very warm welcome, Doc.
Thank you so much, Chhavi. That sounds like a lot, but I'm just an orthodontist at the end of the day, and I'm so glad to be here. Especially on a topic which is very dear to my heart because I'm the mother of a teenager myself, and I really look forward to hearing Priya's insights today on this topic. So thank you again.
So I have a lot of questions for both of you, and there is so much that I want to know. But I also want to tell our audience that even you can start penning down your questions so that by the end of the webinar, I will also give you a chance to ask your questions, and you be ready with those. And I want to talk about my own experience when I was a teenager and I also got braces. Thank you, Priya, for mentioning that my smile is all thanks to the braces. But I don't know how I would have shaped up, or my future would have shaped up, if I did not get the braces. But I do know that when I didn't have the braces, I was facing a lot of self-image issues. So I want to ask you, Priya, what do you think? How can a teen's self-esteem affect his or her future?
Well, Chhavi, I believe that we cannot outperform our self-image. Whatever we think of ourselves, that's how the reality around us will adjust. And self-image forms at a very early age, and then it cements deeper. And it's very difficult to change it. And even you will see that adults today, when they go into therapy, ultimately it all comes back to childhood and teenage years. That is what shapes us. Like if we go back and track our attitudes, we can plot it back to the time when we were in college and so on. So, and even though we do a lot of repair in adulthood, but still you're never going to get those years back. These are the best years of our life, and as a teenager, it's very, very difficult to manage or to handle one's self-image once it is hit, because you have friends on the side who put pressure, and the parents seem too distant. As a teenager, there's a firm belief my parents don't understand me. Even if they do, even if they come up and say, I'm your friend, no, you're not my friend. And my friends are also not my friends. And therefore, poor self-image leads to a lot of introversion and also self-destructive attitudes, just because my self-image is low. And depending so much on the environment, is very, very damaging, and especially so in India. Because you see, we come from a very overprotective culture. We seek validation at every point. There are comparisons at every point, starting from the house. And when you go out into the world and make friends of your own choice, see, when we are younger, the friends are also imposed on us. The parents decide who your friends are. But the minute you're a teenager, you have a choice of friends, and there also there's a lot of validation and comparison which can hit our self-image negatively. And if it's negative, what's the result? Where we either become rebels or submissive or self-destructive. So, and that stays for life. That hampers our decision making. And then the future with that kind of filter is bleak.
And you rightly said that it's very difficult for parents to understand their teens no matter how much they try.
Yeah.
And I also feel that I really was trying to convince my parents for the longest time, can you please get me braces, man? If it doesn't make a difference to you, just do it already. So,
yeah, my parents didn't, My parents didn't get me braces. We just couldn't afford it back then.
That is also another reason. But Dr. Tapasya, you yourself work with so many teenagers, and what do you think? How do you take it when they experience, they want themselves to look better, or they want themselves to look perfect?
Yeah, so, because I'm an orthodontist, I do see maximum of my patient group is the teens, anywhere between the age of 10 and 15. And most teenagers who undergo orthodontic treatment stay with us, we see them regularly for about 2 years. So this is a great topic, or a great question, I would say, on self-image, because, when they come in for treatment, whether they push their parents to do it or the parents bring them in, before we start treatment, we assess their smiles, we do some pre-treatment records, and we ask them to show their smile, or, take some smiling photographs. A lot of times I see that they're very hesitant to smile. They're so conscious about, smiling. And when I prod them, they would say, this is how I smile. I don't show my teeth, and because I don't like the way I smile. So if I fast forward this to adulthood, like Priya was connecting the dots, I also see a lot of adult patients, more so now with, new technology where we can treat adults as well. And I see the same thing. Just yesterday, I had a patient in the practice, and she's a beautiful girl, but she would refuse to show me her smile. And I would say, I'm your orthodontist, you need to show me your smile. And so I said, can you show me some photographs? She was browsing through her phone for 10 minutes, and she did not have one picture to show me where her teeth were showing. So this, I feel, gets so deep-rooted. And, if you kind of speak to them, that this is how they've been through teenage years, and they've gotten so conscious about that girl was so overconfident, super confident otherwise, a brilliant girl, but they're so conscious about this one small thing that it just kind of gets deep rooted. And even though all of these people grow up to be great individuals, but somewhere that self-image issue does stay close to the heart. And if not during teenage years, they do kind of now want to address this as adults, which is obviously can be done, but it's harder. It's harder on them to do it. So which is why I feel that probably targeting this issue when is the right time is the best time. Also, since like I said, we see these kids for almost a span of 2 years. Though I'm not a therapist, I'm not a psychologist, but we talk to them every visit. We spend a lot of time with these kids, and I do see a change in their self-confidence. The way they see themselves. They take selfies with me often. So at the end of the treatment, when I ask them for a post-treatment photograph, they give me a big beaming smile. So I think there's a big relevance, of the self-image to how teens perceive themselves today.
And the self-image in itself also has a big role to play in a person's own outlook towards things.
Yeah.
When you have a great feeling about yourself, you're probably looking at the world in a better way also. But Priya, we often talk
I
about...
want to mention here, Dr. Tapasya was saying that she had a patient who wouldn't show the smile. So when I went to my orthodontist and he said, can you smile for me? I smile like this. All my life, I have laughed and smiled with my hand on my face. So if you see me smiling, if the hand is on my face, means I'm smiling for who? So I can totally relate with that. Totally.
Yes. So when you smile like this, even I used to smile like that before I got my braces. Now you can't just stop me from smiling. But when you smile like that, you're basically just smiling from within. That's it.
Exactly.
But on a more serious note, smiling from within and looking beautiful from within is good. But Priya, what do you think? Can cosmetic change actually help you change your outlook in life?
See, I'll tell you, cosmetic or aesthetics, it's a very high band of influence. We are attracted to beauty, and we believe that beauty is good. That if you're beautiful, you must also be a good person. And then they discover the devil in you or whatever is behind. But as human beings, we have a natural affinity towards aesthetics and beauty. So yes, aesthetics and looking good impacts our self-esteem. But you know what? If I am not convinced about my looks, like there are so many times you tell this girl, oh my God, I love your hair, or you're so pretty. But if she doesn't feel that, then your validation and compliments mean nothing. So it is also then that has to do with your self-image. What you really think about yourself. That I tell you, I was at a college one time and this girl was really, nice and slim, and she says, no, I put on weight. Seriously, from where? So I think that matters. To give you an example, I have a mole and I had another mole, on my nose, which I found very irritating. I thought I looked ugly. So there was this little kid who said, you've got black spots on your face. It was just 2. How it is when people start putting you down. So I got this one removed. All right. And then a few days into it, I told my friends, do you notice something different? When you've done something? And they're like, no. And I'm like, I removed my mole. And they said, did you have one? So imagine, people don't notice you that much, how much we feel about ourselves and we beat ourselves down and are introverted. Everybody I said that I've removed my mole and said, oh, did you have one? And I had to show pictures, that yes, I did. But look, if I'm going to make, that was something I felt about, that I didn't like it, and therefore making cosmetic changes helps. Like I had crooked teeth and I got them all straightened for me. So I don't smile like this anymore. It was for me. But if I make changes to fit in, then there's no end to it. There is
exactly.
that is damaging. And
exactly.
I think
and nowadays, when you talk about cosmetic changes, there is so much available with the development of technology that there is no end, right? So,
Absolutely.
Dr. Tapasya, would you like to throw some light on what treatments are actually essential and which ones are non-essential?
Yeah, so people think that braces, orthodontic treatment is just to make us smile better. What they don't know that when parents think, and so a lot of parents think, oh, my child's smile is good. My child doesn't need orthodontic treatment. So orthodontic treatment can be only aesthetic, or just purely cosmetic. And it can also, in more cases, in fact, more number of children, it is aesthetic, but also functional, which means that there are issues that need to be sorted, which if not fixed at a certain age can be damaging to your dentition. So I don't know if you know this, but orthodontists are also called as dentofacial orthopedists, which means that we can actually modify the size and the position of the jawbone, the upper and the lower jawbone, but it can only be done during the early growth period, or I would say between 7 to 14 years of age. Now, when do we need to do that? When you have a small upper or lower jaw, if you have a narrow jaw. Now, why do you need to fix this other than, purely aesthetics? It can affect big reasons. It can affect your chewing, mastication, but in a lot of people, you can have major issues when you get older. For example, a smaller lower jaw can constrict your airway. It can lead to sleep disorders like sleep apnea, which a lot of people are now getting familiar with. A small narrow jaw can cause mouth breathing in children. It can lead to nasal obstruction and other nasal pathway related disorders. So there are so many things that we have to look at in growing children. We need to make sure that the jawbones are developing well, and these are the essential treatments. Even if you don't have a jaw disorder or you don't need orthopedic treatment, just having straight teeth, helps you in maintaining great oral hygiene and make sure that you can retain your natural teeth throughout life, which itself is a big benefit of orthodontic treatment. So yes, there could be like some treatments which are purely cosmetic and very mild, and which are sometimes we do just because, the child or the parent wants it. Sometimes you have parents that want that. But in most cases, the children do need treatments which are essential. And so seeing an orthodontist becomes essential there. And like, Priya was saying that it is from within. So when I see a child, before I ask the parent, I always ask them, what is your chief concern? Do you have an issue with your smile, or do you think you want to fix something? And that's when I get the answer. I know, okay, I have to fix this for this child.
But tell me, does that mean that every child should take an orthodontic consult?
Yes. So the Indian Orthodontic Society recommends that every child at age 7 should seek an orthodontic evaluation because, you need to assess the bones. Sometimes you also need interception, for things like a persistent thumb sucking habit, which may seem very, just normal for a child. But, a lot of parents don't know at what age it should be stopped because it can cause permanent damage to your jaw and your teeth position. So orthodontic evaluation is very important. And of course, we do start treatments, for braces, like regular treatments start after the age of 10 when all your permanent dentition erupts.
So this reminds me that my daughter was a thumb sucker, and she sucked her thumb till the age of 4. So obviously her the teeth are all not aligned very well, and we were also advised by her dentist that she should go and meet an orthodontist. And I'm very happy, I'm very proud that I took her at age 7, and he told me that okay, her treatment will start only at age 12 once she has all her permanent teeth back. So I know that okay, I'm doing something right here. But Dr. Tapasya, can you also tell me what are the different kinds of treatments that actually are available?
Yeah, so today with so much advancement in technology, you have lots of options. Traditional metal braces are still around, which I think you might have had when you had braces. But there is an increasing shift towards aesthetic options, less painful options for moving teeth, like tooth-colored braces, like clear aligners. You can even get customized braces made for yourself, which are really, really advanced. So, we're talking about Gen Z here. Now, this generation has experienced technology, mobile phones, social media from the time that they've been born. They're born into this age. They're very different from my generation, at least. And so they're also very image conscious. And often they are the ones that push their parents to seek an orthodontic evaluation. And, they can relate to and they want the latest in technology for themselves. All of them know that, they have the latest gadgets. And so, we have to offer treatments for them that they can connect with. So I do get a lot of, I would say, requests from patients to do Invisalign aligners. We are talking also about aligners today. From the teens themselves, not necessarily the parents, as they don't want to have painful process during treatment. They want to look good, but they also want a comfortable treatment, journey, as so to say. So, apart from being invisible, these aligners, they do not impact their lifestyle in any major way. They can eat what they want. They have minimal interruptions in their daily schedules. We know that teenagers are very, very busy. Parents of teenagers are very busy. And, so there are lots of benefits. And often it's the teens who research and read up and come and say, can I get Invisalign? Or my friend's doing Invisalign. It barely shows. It's very comfortable. Also, the fact that, Invisalign is a purely digital treatment process and it is customized for the patient. We can actually show the teen and the parent a simulation of how your teeth are going to look, how is your smile going to look when your treatment's done. And all this is done through advanced technology before even starting their treatment. So the whole visualization makes a huge impact. Also, it keeps them motivated throughout treatment because they know this is my endpoint. This is how I'm going to look. So I need to do this well. And the other benefit is they feel super confident throughout treatment because they're wearing something that is really comfortable to them.
So that's amazing. I mean, it's such a simple thing and it can not only create wonders when it comes to how they look, but also, change their own perception about themselves and hence play a very important role in how they actually end up shaping their lives. It's amazing. And also you're saying that there are so many other complications which you can actually, sort of do away with if you take a treatment in time.
Yes.
Right? So it is in my head, what I'm hearing is that it's a very simple solution to a simple problem, which unnecessarily sometimes we complicate by just delaying the whole process. So Priya, how would you say that if it's such a simple solution to a small problem which may or may not escalate later, why don't parents just do it? Why don't we just do it?
Well, I think, I think for lack of education, in understanding, because the way Dr. Tapasya has explained, there are other factors just to than aligning your teeth, and which are major factors. And it's always important to rule it out. I think caring for your looks, your smile is just, coming up. And if a child is not smiling, you need to get to the reason why. It could be, inhibition of the teeth. And I feel that smile actually promotes health. They say that you use the maximum muscles when you smile. The brain secretes endorphins, you feel happier, your immune system responds better. So it's, I think, just lack of education or lack of awareness that there are deeper issues connected with your teeth and your jawline. So I think once initiatives such as these come up more, there will be awareness and there will be action to it.
Priya is breaking up a little bit. Dr. Tapasya, can you hear us?
I can hear you.
Yes, I can hear you too.
Chhavi, you did freeze. I think your screen froze.
Yeah. Yeah, see, this is where we are in the internet age.
Yes.
But I really like Dr. Tapasya. I feel initiatives such as these bring a lot of education. Like, I think every parent should take their child, for an assessment. Maybe everything's okay. So
yeah, exactly. I think it's like, when you take your child to the pediatrician, like you just
Yeah,
want
exactly.
evaluation. So
Yeah.
it doesn't have to be an orthodontist. It could be a general dentist. That's why you start.
Yeah.
You don't just
Yeah.
go to a specialist. So I think what's important is, just take your child for just a general evaluation. You don't have to go every year. It's a couple of years, like I said, 8, 7. The dentist would guide you accordingly and say, okay, yes, I think you may need to see an orthodontist. Oh no, let's wait till the child is 12. So it's
Right.
just-
And
just
there could be
awareness.
exactly, and there could be a distinction whether it's really a health-related problem or an aesthetic
or
issue.
aesthetics. Yeah. And parents do ask us, is this purely aesthetics? And I tell them, this is purely aesthetic, or no, this is absolutely needed, or this is both. So of course you can do correction for a jaw thing, but at the end of it, you're also getting a good smile, right? So
Yeah.
that's the icing on the cake.
I lost you guys there for a minute. I missed out on some part of the conversation, but definitely coming back to smile, I'd like to share a small anecdote from when I was a kid. There was this person, this Didi, who visited us once, and she had a beautiful smile. So my mother complimented her on her smile, and she said, "Thank you, auntie. I have $1 million smile." And that was the first time ever that I heard that. And then she told us that it's not all me. I actually got braces. I always had a beautiful smile, but now I have $1 million smile. So, and that kind of just stuck with me, and it also sort of made me feel that nahi, braces to main lagwa kar hi rahungi, and I have to find some way to convince my parents to do that for me. But also, I think for a lot of kids, another thing that kids, especially the teens, say amongst their peers is, like you spoke about pressure, Priya, initially in the webinar, you were talking about the pressure that kids are under. So this peer pressure, in fact, in my opinion, I think 90% of the decisions that teenagers take come from the peer pressure only. Everything depends on what their friends have to say about a certain issue or a topic. So is peer pressure always a bad thing?
Sorry. Sorry, I have two dogs. We were discussing this earlier, and they like to be a part of the conversation. So, see, peer pressure can be both good or bad. And I feel that, see, as parents today, we've been through that, right? So, understanding that, look, our children are also going to go through the same stages and might as well put what we learned into practice. So, when the kids are growing up, make conscious effort to put them in the right company when you are the authority on choosing their friends. And how you do that is, first you make sure that the kids that you are, promoting your children to hang out with, are they involved in extracurricular activities, which is great for personality development. How are their attitudes? How are their habits? What kind of value system? What kind of family? So the child has evidence, has experience of dealing with good kids, with good values, so that when they go out into the world and they see a misfit, they are able to make a distinction. And intelligence lies in being able to tell the difference, and so, having friends who push you forward and put it not as a thing to ridicule you, but to improve you, I think would be nice. So an approach such as, I think your smile can be better because he did this, versus have you seen your face in the mirror? So I think it's a lot comes from the choices that you make for your children early on, so that they can make better choices when they are teenagers and adults.
So what do you have to say about this, Dr. Tapasya, since so many teens visit you every day?
Yes, so I do see this peer pressure thing around me a lot, and I do get a lot of friends of existing patients who want to come and get braces done. And sometimes, like I said, they don't need braces. Sometimes it's purely just because their friends have it. So this is my responsibility as a doctor to tell them that, see, it's fine, you don't need it. Or maybe it's because it's a slight thing, and for me, from my perspective, you don't need it. So it's, as a doctor, I have to be honest with them. But yes, I do see a lot of this peer pressure thing. Like, there was a time when every child coming to me wanted colorful braces, because my friend has it. I'm only going to go for this. Even the parent says, no, go for the aesthetic braces, or let's do Invisalign. But, that again, now the whole trend is shifting. Now it's like, I want Invisalign. So again, if that's Invisalign, I might tell them that, okay, maybe for your case, I'm not sure if this is going to be the best choice. Or if you're going for metal braces, maybe this is not the best choice for you. So the pressure definitely plays a major part. And sometimes you cannot, make them see sense also. Sometimes you have to go with what the child or the parent wants. And as long as, I'm educating them correctly about what works best for them, as a professional, I think that's important. In my personal life, also, I see a lot of peer pressure handling, because I have a 14-year-old son. And, he recently wanted a gaming laptop, which is high-end. And I said, no, my friend has it. So sometimes the parents, it gets hard, So sometimes kids can be very demanding and at a certain age. But like Priya said, you have to direct and make them see reason from a very early age, put them in the right place, and kind of nurture them from there. So they see your viewpoint also. Eventually it's like a conversation with your teenage kids. What's the pros and cons of this? So, like during the COVID time, I did a lot of video consults, and so it was like the mother, the father, and the kids. And there's this whole conversation that goes around telling them the benefits and the disadvantages of certain, let's say, metal braces versus ceramic braces versus Invisalign. So at the end of it, yes, peer pressure is there, but I know that parents of teens also know how to kind of work with it, and we have to all work around it. And it's for me, it's like like a discussion with the parent, with the child. We sit together with the doctor and have this whole discussion. So sometimes we're able to convince the child to go for a certain kind of a treatment. So yes, peer pressure very much exists, and we can use it in a positive way. Also, because like children come in, we tell them, okay, see your child, like I have to sometimes put some horrible devices in the mouth also. And so, you can kind of convince them saying, see, this child is doing it. We have other kids in the clinic. And they do get convinced that, okay, there are other kids doing this as well.
I think in my case, peer pressure worked in the completely opposite way, where everybody made fun of me, Priya. Everybody made fun of me and told me, yeah, go see your face in the mirror. And it worked in that sense that I totally got determined that no, I am going to do something about it and not just going to go to the bathroom and cry.
But you're a positive personality, right? So it also makes a difference on the kind of a person you are, right? So I think it's very important. Of course, I get kids like that who say, I really don't like the way I look. Or their parents who say, I want you to fix my child. Child is super confident with, the way they look. And I don't know why my parents want me to get braces done. So it's both ways, but yes, I think it is a parent's responsibility to take their child at that age, because the same kids who are totally confident about it at that point, I do see a lot of adults as well, like I said.
Yeah,
so when it comes down to that point.
That reminds me, my daughter was telling me yesterday that I don't ever want to get braces. And I am a parent here who thinks that she should because the doctor suggests so, right? And I don't know, like after today's session, now I know that later on in life, she may or may not have other problems because of whatever fixing she needs right now. So I think as an aware parent, it is my responsibility to also tell her, educate her about the pros and cons of getting braces and not getting braces, and that she's going to get braces for a certain amount of time and what she should experience or expect at that time versus how she's going to be after the braces, the whole treatment is done. So I think as a parent, all of us, all the parents who are also attending this, it is our responsibility to let the child also make an informed decision at some point. I think I'm done with my...
And that's why when the child comes in, sometimes, we work like their counselor. A lot of teens or children don't listen to what their parents say. So I have to explain to them why they need a certain treatment. And of course, like I said, now we have better options, right? We don't just have to look at, they don't have to visualize it as, I have a train track mouth, So I tell them, see, you have better options. It's not that you have to be super uncomfortable or it's not going to be super painful. Yes, there's an adjustment needed, but so the whole counseling is needed, and I think children are very smart, and I think we have to understand their concerns as well and address them.
Yes, and I'm totally charged up after this session because I was also suggested by one orthodontist that I should also get some XYZ treatment, and he explained to me what I might expect 10 years from now if I don't do it today, and after 10 years if I decide to do this treatment, then I might have to do 1 + 2 + 3 and a whole lot more. I think I'm definitely going back to him and taking another advice, another consult from him. But I remember the audience, I had asked you at the beginning of the webinar, if you have any questions, you start noting them down, and now is the time. You're free to throw your questions to us. And the first question is already here from Mahalakshmi, and this question is for Priya. As a parent, how to balance my professional and personal pressure so that it helps me at ease to counsel my daughter when she's pressurized in studies? I also want to know the answer to that.
Well, see, there is no balance, first of all. And I'll tell you, as parents, there are also a lot of complaints that the children don't have time for them. So it's not just that you don't have time for the kids. Where do they have the time? They are also very busy no matter what the age. But I think maintaining an open relationship, where they can come and talk to you and what you say would be accepted by them is very critical. And that can happen in bits during the day. Make the effort to see your role, with your child is of a fan. Forget a parent, and I say this from Pulila Gopichand's book. He says, when you're bringing up a sports person, when you are taking your 8-year-old and training him to be a champion, forget that you're a parent or a critic. You're only a fan who appreciates him. The job of actually coaching him, training him, correcting him is of somebody else. So I think if you have a relationship of encouragement and empowerment, your children will come to you. And I know of this, so it isn't impossible. It is possible, and you can start today, no matter what the relationship has been. You can start laying the groundwork today. And I think within once the child sees consistency and sees mom has changed versus give it another 2 weeks and she'll be yelling at me again. So I think making that shift and change is very important, because you rather have your children come to you when they have a problem versus even going to their peers who are only going to experiment with them. They'll say, do this, and then follow up. What happened, because they're also gathering feedback whether this works or not. So I think yes, starting that journey of empowerment and encouragement can start today.
And I think what also could make a difference is whatever, like she's asking about her professional and personal pressure. So I feel that even whatever time that the parent is getting to spend with the child, if you can somehow make it quality time, and if you can't focus on the quality, that will go a long way. What do you say, Dr. Tapasya? You also have a 14-year-old.
So, the same thing that, you have to encourage them. So when I see a child, for example, in my perspective, supposing you're getting orthodontic treatment done, right? So you have to follow lots of precautions. You can't eat a couple of things. You have to brush 3 times a day. And their parents come and say, I can't handle my child. They don't listen to me. You handle them. That's a common complaint from parents. And so I have to, like she said, you have to empower them. So I have a regular, I have an in-depth conversation as to why is this important. It's their teeth, it's their mouth, it's their body. And if they don't take responsibility for it, I can't do anything about it. I can straighten their teeth, but I can't, improve the health of their teeth, or it's going to get more messed up. So, I tell them, you decide. You're old enough to take a decision. 13 or a 14-year-old or even a 12-year-old. I mean, there's such smart kids today. So, and I tell the parents, don't complain about them in front of me. Let me speak to them one-on-one. So I think that is very important when you're talking to this age group. Let them take onus of their actions. Let them take responsibility. And I've seen that it works. It's like a regular speaking, conversation, building relationship that you have to build with them with time. And then they start listening to you. They start following what you're telling them. So I think it's very important to start a conversation, be consistent, follow up. And in obviously the teenage groups, I don't let the parents kind of come in too much, and I tell them, let me handle them at my own level. And it does work wonders. They do start listening to you. So I think it can be done.
Yes. Thank you so much for answering that. Before I move on to the next question, I'd like to request everybody in the audience, if you have any questions, please use the Q&A tab and leave your questions there. The moderators are going to filter out certain questions and throw them to us. So please do that. And the next question is from Neenu. I think, Priya, you were mentioning about how you can decide or select a certain group of friends that, you can sort of choose for your kids. But she is asking that as a parent, we choose friends for them. Are we again not imposing on them?
Imposition, I think not, because you're putting the right people in their place for them to be able to make a difference later on in life. If you look at the greatest angst of an adult is they're not able to recognize people. And then they say, I don't know why this happened to me, and I don't know, I never knew this. So to be able to understand people, it must start on the right foot so the difference can be seen. You're doing this as a strategic thing. Why would you not want your children to have good friends? So that they move in that direction. And we choose their food, we choose their clothes, we make a lot of choices for them till a certain age. And that is all I am requesting. Till that certain age, give them the full exposure to goodness, to intelligence, to great personalities, to great values, so that when they move out of that zone, they can see something's different. And you know what? After a stage, they will go out and make their own friends. And you know what? It could also be that these friends that came along, they could stick for life. Then you also have friends from school, and there's something about them. They couldn't be those fly by and hurt you people. These are people who stayed, and look at that. Where did they come from childhood? So it's just that.
Also, I think as a parent, we do have to make these tough decisions for our kids all the time. And when you decide to filter out the friends that they are hanging around with, it is a tough decision. And sometimes you have to be a little stern with them. But it is your job. It is your responsibility. Maybe you find the best method of approaching them, or change your approach towards the whole situation. But it's definitely something which is imperative.
And it's worth it. You're putting good people in their space.
Absolutely. Okay, so this next question is a very relevant one also. Dr. Tapasya, this is for you. That we are talking about self-esteem and self-image issues. Wouldn't braces cause issues for my kid in school or sport, or would it not hamper their confidence? What do you say about that?
Yes, so it has different viewpoints. So there are children who actually come and say, I want braces because my friends have braces. On the other hand, there are equal number of kids who come and say, who are very conscious about their smile to begin with. And for certain types of kids, I would say that yes, putting braces, the children are not very comfortable. They say, I don't want to put braces. So now you have options, right? So you have aesthetic braces, which are tooth colored, which barely show. Invisalign, of course, is a totally invisible option. So for me, the reason for doing, I do everything. It's not like I only do Invisalign or only do metal braces. As a doctor, I have to provide all options. And so that's why that initial conversation I have with the parents and the children, I try to understand the child from his or her own perspective. So if I have a child who's super conscious, in fact, at all times the child would themselves tell me, I don't want braces. I'm just not happy to wear something which is going to show. And I say, okay, you can do Invisalign, you can do an aligner system, but this is what it involves. It's a removable device. You have to be super compliant. And trust me, when they don't want braces and they have the alternative, then they go for it. They listen to everything I say. So, my youngest patient with Invisalign is 8.5, which is probably a daughter's age. And, I'm doing a jaw correction with that. But he's like one of my best patients, So, yes, you have options. And yes, for some children, wearing braces could add to, further affecting their self-image. And then we have options for that. But there are also kids who totally chilled out about it. And, if I tell them to Invisalign, they might say, no, I want to do braces. So I say, okay, go ahead with that. So we have options for everything now.
And when I got my braces, we did not have options like Invisalign at that time. So there was only that metal thing that I had.
That was the only thing
it was extremely uncomfortable, but I think it was just that short-term discomfort. And I think every child should look at the long-term benefit towards it also. No, and right now, like you rightly said, there are so many other options also available, so no stress at all.
Yes.
And there's this other question now. It says it's important to start early your career. For that, finding child's interest in things he or she loves to do is crucial. So, how to find what your 5-6-year-old child loves to do? What are the signs? What is that we as parents or guardians can do? Priya, would you like to take that?
Sure. Well, observe, pay attention and don't control. Sometimes what the child loves to do may be irritating for you, but at least look at it and look at the person's interest and encourage it, ask questions. Like, for instance, I'm a motivational speaker. I've been a speaker for 25 years. And guess what? I was always talking. My diary was, the school diary was always filled with talks too much. And guess what? And I would get reprimanded for it. So there are times when you see your child interested in something, I would say be curious. There is $1 million business even if your child loves to sleep. I was in Dubai, at the Dubai airport one time, and they have these cells at the airport where you could just lie down and sleep. And for somebody like me who travels, that 1 hour of nap is a lifesaver. So I was very curious who came up with this idea, and the guy says, I love to sleep. I understand, the importance of it. So encourage it. And look, it could also be it's a whim. It could also be it's a passing phase. And as children, we are interested in a lot of things. But be willing to experiment. You're helping the child discover something. But you know what? Let me also warn you, no matter what you love to do, and when you push your child toward it, the process he may not like. Like kids today, they want to be cricketers, but they don't want to wake up at 4. They don't want to go for practice. They don't want to sleep early, So it's quite something to teach them that, look, if you love something, the process may be something that you hate. So balancing that love-hate relationship via a good talk, showing them reality, encouraging them to meet mentors, encouraging them to look at the lives of great people, I think would be a great form of education to develop their personalities and, of course, their careers.
That's very well said. And I think observe being the golden word, because a young child That is the best. I think that is the best gift a parent can give to the child. Just observe the child. You will understand what the child likes. The child will understand by doing various different kinds of things. The child will understand what he or she himself or herself likes also. So now we have the last question. Session is coming to an end. I'm really, really enjoying this. The last question is how to handle teenagers. Oh my God. So that they share their feelings with parents, especially when they are exposed to media so much. I think we're going to go on for the next 1 hour now. What do you say, Priya?
See, I tell you, teenagers, and I see this with a lot of my friends, they have these Instagram accounts and Facebook accounts, and guess what? They block the parents, so the parents are not on it. So what's going on in their life? They have no clue. I had a friend of mine who took her daughter's phone and said, give me the password. She was willing to let go of the phone, but not give the password, so it is tricky. And I think, there is, like we always spoke about generation gap, even in our generation. But now it has quadrupled. It's not generation gap, it's two different planets. And I think parents need to make the effort to get on the same level as them versus expecting them to understand you. So being on the same page and discussing it openly, and exposing some of your vulnerabilities. Why do you have to look so strong? Why do you have to pretend? Why do you have to be the teacher? Just be by your example. If the child is going through something, what's holding you back from sharing some of your life experiences and stories, and so on. So like my mother told me, she used to, about her childhood days, about the problems that she faced. And I landed up counseling her. It's okay, mom, let it go, and so I get perspective. I look at who my mother is today, and I realized she turned out okay. She's my hero. So being honest about who you are will help them understand who they are as well.
What do you say, Dr. Tapasya?
So yeah, teenage years are a troublesome year. I'm a mother of a teenager, so I have these clashes and fights and arguments all the time. So definitely, I think you do have to give them some space. They want their own space. They want a lot of space. They don't want you into their rooms, into their lives, and I think we do have to respect that. At the same time, let them know that you're there, and you're there if they need you for anything. Your communication channels are open, and kind of try to get into the conversation mode with them, and then the mood, just kind of. I often do this with my son. I just go to his room. Sometimes he doesn't want me inside his room. Sometimes he's open to it, and I say, okay. We just start talking random things. I don't ask him pointed questions because then he's going to shut up. He's not going to tell me what's going on. And so, when the conversation starts going, then he automatically would start sharing things with me. And I see that with my patients as well. Sometimes they would share a lot of things with me that, they may not share very openly with their parents. Like some child would, I've had kids who've come and told me, before when I had, I hadn't started my treatment, I used to get bullied. And in fact, I later share it with the parents. So sometimes you have to reach to their level. You have to reach at their level to communicate and let them know, develop a comfort zone with them, whether it's your own child or whether it's other children that, for me, my patients, and let them know you're there to listen to everything. So because I see them every month for follow-ups, I see them very often. Every time they come, my work is 5 or 10 minutes, but they're on my chair for at least 20-25 minutes because I have a chat with them. I say, oh, what's happening? What are you doing on Instagram? They'll open their Instagram and then they'll show me photographs, or they have a patient who's into cooking. She'll say, this is what I cooked, or, I have a patient who's he's into cars, he's into car reviews. So they would come and say, can you follow my YouTube channel, or can you follow me on Instagram? So, I try to be on their level, and, they do like to share their things. They do like to communicate, but I keep that channel open. I'm not judging them. They know I'm not judging them for anything. So I think it's the same thing with any teen in your life.
Very, very well said, Doctor. I think the mistake probably that all of us make as parents is that we forget to slightly detach ourselves from the child's life when we try to start a healthy conversation. And I think that is the reason why we are able to connect better with other people's teens, but not our own, because we are judging them, like you said.
Yes.
But I think parenting is something which is a learning process every day for everybody. And by the time you figure out how to solve one problem, that problem has changed or the solution has changed. So you have to learn all over again. So that is like a never-ending process and a never-ending journey, a beautiful one though. And the webinar is coming to an end now. I really had a lot of fun. Thank you, Priya. Thank you, Dr.
Oh, you're
Tapasya,
most welcome.
for joining us today and sharing so many pearls of wisdom with all of us. I hope that the attendees also had a lot of fun. I wish I could see everybody, face to face, and things would be different. We can actually, say and nod our heads together and, sort of feel one in that sense. But the good thing is that this session is coming to an end, but this is just the beginning. This is the beginning. This is the first part of a 3-part webinar series by Invisalign. We will be talking a lot more about teams, and there'll be a lot of more heart-to-heart conversations happening. So please stay tuned and for the date to find out the date for the next webinar. And I'll see you again, guys. Thank you so much once again for coming here. And this is all of us signing out. Love and peace from us to you.
Thank you.
Bye.
Thank you.
Thank you so much. Thank you.